$2 million from RBC to address a critical need in healthcare, to better prepare young healthcare professionals to ensure they lead long, healthy, and fulfilling careers. This transformative gift is for the Young Professionals Development Program, which is there to provide educational and wellness needs for healthcare workers in the first 5 years of their careers. Nadine Renaud-Tinker is the president of RBC in Quebec, and she joins me now to talk about the gift. Hello, Nadine.
Hi, Tara. Pleasure to be with you today.
The pleasure is ours. Now, Nadine, I want to take you back to the day the donation was announced, just a few weeks ago, where you saw how the money would be spent. You saw healthcare teams practicing stressful scenarios on mannequins. You even used an AI helmet on a birthing mannequin, which is used to train young health professionals, so they can train before they do, which is such a wonderful thing to make a donation to. What was your experience like for that?
Well, it's first of all, whenever we get implicated or engaged in any cause, I mean, it's our fundamental being is to help communities around us, right, and to make meaningful change. And so to be able to live it and see doctors in practice and nurses in practice, literally trying to save a life in the AI robot, and to see how it works, to have them practice this way, it was just really concrete way that our dollars are going to helping young workers for the next 5 years, preparing them to have success in their role, whether they're a doctor, a nurse, or any other healthcare practitioner. So to me, that's meaningful help. Like it actually prepares them before they are dealing with a patient. And the other piece that really marked me when I was having conversations with the nurses and the doctors is they told me like how good they felt, like how much more confident they felt to be able to be in front of a live patient now that they've practiced 2 or 3 times on different scenarios, right? It's almost like real life. I mean, you watch it go, and it's really, you don't know what scenario is going to come up, and they have to find solutions as a team and save the life of the patient was the example that I was able to see in particular. So it really is meaningful because you're preparing them, our healthcare professionals, doctors, nurses, to do their jobs better. And the other piece is what you mentioned is also about mental health, right? Mental well-being. So when you're dealing with people's lives, it's incredibly stressful, right? And so we've got a new slew of, like any kind of environment, work environment today, a new slew of new workers coming in, and with the MUHC, which is one of the fundamental hospitals for new students and trainees who develops for the entire country as well. Well, we want to train these people. We want them to these specialists. We want them to feel confident about what they do, and that stems directly to mental well-being and mental wellness. When you're confident that you can make a difference and you can do your role and you can save someone's life, it means a lot to these professional workers. And that's exactly what came out of the 3 nurses I was speaking to. They said to me, Nadine, I feel so much more confident now. I've practiced, and now I can go work with the real patient and give more care to the patient as well, right? Out of respect of that.
We're speaking with Nadine Renaud-Tinker, the president of RBC in Quebec. We're talking about a $2 million donation. And I think the donation is so timely. And I'm wondering if this went into the thought process in terms of the donation, this particular donation. With COVID, the healthcare system has been so stressed, and more young professionals are starting their careers. And as someone who's attained a position that you have, obviously the value of mentorship and how important that is. Can you talk a little bit about that?
Yeah, no, sure, Tara. Obviously, we all know the last 2 years have put an incredible amount of pressure on the healthcare systems, on non-for-profit, like where there was already a stress, it's been put to that much more challenge. Add the fact that, you've got a retiring workforce in many areas and a new workforce with no experience coming in. So it's really, we're at a turning point, right? But you've got a lot of pressure on the healthcare system, especially in Canada. So we, in 2017, we made a commitment. RBC made a commitment to support and empower, youth and the young workforce, the young people entering the workforce. So this, to me, this donation that we've made to MUHC addresses that exactly. It's a commitment that was called, if you've heard about it, Tara, it's called the RBC Future Launch. So it facilitated access to work-related program, different tools, technology, resource tools, and in the case of the MUHCs, we've used it for the AI program, and we've helped to date over 3 million people, 3 million youth workers all over Canada. So it really means a lot, but what we're doing is we want to help basically build the youth and the workers of tomorrow. And again, as I mentioned earlier, is how do you build this confidence so they can they better serve patients and better care for our patients. It's so important. And it's this program in particular is 5-year experience that we're giving our new doctors and nurses to help them with the tools that they need to create skills and create a safe space to learn, as I mentioned earlier with the 3 nurses I was speaking with, right? So, and I think for us, it's also a donation that continues for years. We've been partners of the MUHC for many years, for over 30 years, and we've also been involved in the RBC Art and Heritage Center, and that, the RBC Art
love that program.
Exactly, right. It's also for mental well-being and for the patients and the families that are coming to see their families when they're not well, and whether we're delivering meals, whether it's art on the walls. I mean, creating a hospital environment that's more friendly and kind in people's lives, which is usually a very stressful moment when you're in the hospital.
$2 million from RBC is a substantial donation. And personally, I think it's good to hear that institutions like RBC are giving back. I think it's good for people to hear about it. Is it part of the corporate culture there?
Well, definitely. I mean, there's it definitely is. It's part of sustaining the communities around us and the communities where we live is our raison d'être, right? It's what we live for. Yes, we are there to build our clients, but we're also here to build our communities, right? So it's part of who we are, a very important pillar of RBC. And Tarah, you're probably getting to know us a little bit more. I mean, it's great to write a check, but again, as I mentioned earlier in the conversation, it's also about the meaningful impact that we want to have, right? It's helping create the future. It's helping create a future that's bright and that works for today's environment and the future, because everything's changing. And what this program does is it builds it permits for an environment that doesn't exist right now, does not known in Canada. We hope, all of us hope, that it actually is an example to many other programs that would be developed across Canada or across the world. I mean, this is the way to learn. If we're accepting a very high number of new students and youth in the workplace, especially in healthcare, well, we need to train them. We need to develop them. So it's meaningful. It's so much more than a check. We want to be able to save people's lives and help people through their illness and families through this, and through helping the medical worker, you're actually helping the patient, right? So it is meaningful. You're giving access to tools that were not available before. It's absolutely fascinating. And the one I did see you mentioned earlier was also the birth of a child, right? Like when I had the goggles on, and that was obviously a much happier moment to watch, but it was literally watching like you were literally in the room with that mother, again, with that AI robot. Again, like the nurses get to practice and get to see what's going on inside of the mother's body and the baby, and you see everything, the heartbeat and everything that's happening. So it's the best way, I think, to learn, because theoretical learning does not help us give better care or does not help our healthcare workers build more confidence. It's training to do a good job, right?
That's it.
Yeah.
Nadine, I only have about 30 seconds left, but I want to mention that you recently joined the MUHC Foundation Board of Directors, which is not a small commitment. The board is instrumental in deciding where money gets raised, how it gets used. Why did you accept to be part of the MUHC Foundation Board?
Well, what I've seen in the MUHC is the past couple of years that I've been staying close to the MUHC, it's their ability to innovate, to go to the hearts and minds. I mean, just this program alone is one of them, but there's thousands, there's hundreds of incredibly innovative programs that are out there that are unique to the MUHC and that help, provide other access to other hospitals down the road. And the goal is to obviously help them, help the community kind of have even that much more impact.
Nadine Renaud-Tinker, thank you so much for joining us on Health Matters and for this incredible $2 million donation from RBC. Thank you so much.
Thanks, Tarah. Have a great day.
You as well. 2